What health screenings should I prioritize to prevent stroke? Imagine catching a problem before it causes serious trouble. That's what health screenings are all about, especially when it comes to preventing stroke. Many risk factors for stroke don't show symptoms until it's too late, so regular checkups are key. The most important screenings include checking your blood pressure. High blood pressure is the leading modifiable risk factor for stroke. If your blood pressure is high, it can damage your arteries and increase your risk of a stroke. Regularly measuring your blood pressure, at least once a year if you're over 40 or have other risk factors, helps catch hypertension early. Managing it through lifestyle changes like reducing salt intake, exercising, and taking medications if needed can significantly lower your stroke risk. Next, cholesterol testing is vital. High levels of bad cholesterol can cause plaque to build up in your arteries, narrowing them and raising your stroke risk. A simple blood test called a lipid panel measures total cholesterol, low-density lipoprotein or bad cholesterol, high-density lipoprotein or good cholesterol, and triglycerides. Getting this test every 5 years or more often if your levels are high helps you and your doctor develop a plan to keep your arteries clear through diet, exercise, or medications. Diabetes is another major risk factor. Elevated blood sugar levels damage blood vessels over time, increasing stroke chances. Screening for diabetes involves fasting blood glucose tests or the HbA1 degrees Celsius test, which shows your average blood sugar over several months. Early detection allows for better blood sugar control, which can protect your blood vessels and brain health. Using risk calculators like the atherosclerotic cardiovascular disease score or the Prevent Risk tool can give you a personalized estimate of your chances of having a stroke or heart attack in the next 10 or 30 years. These tools consider your age, sex, blood pressure, cholesterol, smoking habits, and diabetes status. They help you and your healthcare provider decide on the best prevention strategies. In some cases, your doctor might recommend a carotid ultrasound. This is a non-invasive imaging test that looks for plaque buildup or narrowing in the carotid arteries in your neck, which supply blood to your brain. It's mainly used if you have symptoms like a mini-stroke or transient ischemic attack. Routine screening in people without symptoms isn't generally advised because false positives can lead to unnecessary procedures. It's also important to evaluate lifestyle factors like your diet, physical activity, smoking, and alcohol use. Addressing these habits can greatly reduce your overall stroke risk. Additionally, social factors such as access to health care, education, and socioeconomic status play a role in your health and should be considered. Regular visits with your healthcare provider are essential to monitor these risk factors and tailor prevention plans to your needs. Depending on your personal health history, your doctor might also suggest screening for atrial fibrillation, which is an irregular heartbeat that can cause blood clots, or check your kidney function and body weight. In summary, prioritizing regular blood pressure and cholesterol checks, diabetes screening, and using risk assessment tools are the best ways to identify and manage stroke risk early. Carotid ultrasound is reserved for those with symptoms or very high risk. Addressing lifestyle and social factors completes a comprehensive approach. Always consult your healthcare professional to determine what screenings are right for you based on your individual health profile. Staying proactive with these checks can help you stay healthy and reduce the chances of a stroke happening unexpectedly.